In this lecture, we will review sleep disorders and bedtime strategies in early childhood. According to Armstrong in 2021, quality sleep is important for all adults and all children, but frequently people don't get adequate rest. For parents, it can be hard to know whether a child who struggles with sleep is simply growing up or has a sleep disorder. Well, the American Psychiatric Association defines sleep disorders, also called sleep-wake disorders, as problems with sleep quality, timing, and duration. Living with a sleep disorder leads to distress and reduced ability to function. Sleep disorders affect many children. A 2000 study estimated that up to 50% of kids will experience a sleep disorder. According to this study, common types of sleep disorders include obstructive sleep apnea, sleepwalking, confusional arousals, sleep terror, nightmares, behavioral insomnia of children, delayed sleep phase disorder, and restless leg syndrome. We're going to go over some major ones right now. We'll start with insomnia. Insomnia is one of the most common sleep disorders and affects about 20% of children. The primary symptoms are trouble falling asleep, staying asleep, or both. Medical experts usually divide insomnia in children into three categories. First, behavioral insomnia. Most common in children up to 5 years old. This form of insomnia is associated with resistance to sleep, taking a long time to fall asleep, and frequent nightmare wake-ins. These behaviors happen on occasion with most children, but may be considered a sleep disorder if they occur frequently and persistently and interfere with their normal functioning. Next, we have conditioned insomnia. It's more common in older children and adolescents. Conditioned insomnia occurs when feelings of anxiety related to bedtime and sleep prevent the child from falling asleep or staying asleep. And third, transient sleep disturbances, which are temporary disturbances in a child's normal routine, such as traveling, illness, or stressful life events, can cause short-term bouts of insomnia. Okay, let's move on to obstructive sleep apnea. Obstructive sleep apnea, also known as OSA, occurs when the tissues in the throat block the passage of air during sleep. This can lead to frequent, momentary lapses in breathing and can significantly disturb nightly sleep. Approximately 1 to 5% of children experience obstructive sleep apnea. In children, common causes include enlarged tonsils, obesity, and certain dental conditions or birth defects. Depending on the severity of symptoms and other risk factors such as obesity, a pediatrician may recommend further evaluation by either a specialist in sleep medicine or through a sleep study, which involves overnight medical analysis at a sleep clinic. Next, night terrors. Night terrors are a type of parasomnia in where the sleeper suddenly awakes feeling frightened and panicked. The sleeper usually has no memory of the frightening event. Night terrors are rare in adults. However, about 30% of children experience night terrors, usually between the ages of 3 and 7. Medical researchers do not completely understand why night terrors occur, although a familiar predisposition has been observed. Now, treatment options are limited. The best thing to do is to provide comfort and reassurance after a night terror episode. If you decide to consult a pediatrician about your child's night terrors, it may be helpful to keep a sleep diary on the frequency and duration of episodes. Okay, nightmares in children. We have to talk about this a little bit more. It is important to make a distinction between night terrors and nightmares in children. Night terrors are a sleep disorder that typically occurs during the non-rapid eye movement, also known as NREM or NREM or non-REM stage of sleep. The child will typically have no memory of the episode. In contrast, nightmares more commonly occur during rapid eye movement or REM or REM sleep. The sleep stage usually associated with dreaming. Nightmares are often brought about by stress or major life events. Bad dreams can also cause feelings of anxiety, which the child may want to talk through with a parent or caregiver. A child's sleep disorder can affect the whole family, but there are ways to help improve children's sleep. If your child does have a sleep disorder, a healthcare professional may be the one to help. Now, these are signs of sleep disorders in children. Sometimes it can take kids a little while to settle down before bed, but if your child seems like they're having a lot of trouble, it could be a sleep disorder. Now, each of these scenarios can indicate a possible sleep disorder. For example, your child lies in bed, calling for another book, a song, drink, or a trip to the bathroom for what can seem like hours on end. If your child sleeps for only about 90 minutes at a time, even at night. If your child complains of itchy legs at night. And if your child snores very loudly. Many children have occasional nights of restlessness or poor sleep. If these behaviors continue over several nights, it may signal there's an underlying cause. Now, what about during the daytime? So, during the daytime hours, children who lack adequate sleep may also seem more moody and irritable, act in a more disruptive way, or fail to perform at their usual level at school, and sometimes even fall asleep at school. But what happens when kids don't get enough sleep? We all know that sleep is essential for everyone, and when kids don't get enough, it can affect their health. Over time, lack of sleep can cause a number of physical, emotional, and mental changes in kids, including daytime sleepiness, shifts in mood, trouble controlling their emotions, a weak immune system, poor memory, poor problem-solving skills, and poor overall health. Now, let's review some sleep strategies for kids. The source is sleepfoundation.org. Dr. Elenia Kalenda, actually an OBGYN, is the primary source for these suggestions. It's well known that proper sleep is essential to a child's development. But for 15 to 25% of kids and teens who struggle to fall asleep or stay asleep, getting adequate rest can feel daunting. Helpless parents may begin to dread bedtime, unsure of how to help their little one nod off and sleep soundly. And in case you were wondering, sleeping pills that are commonly turned to for adult insomnia are discouraged in children. Pharmaceutical sleep aids can have significant risks of side effects in children, and therefore should only be used under the careful guidance of a doctor. Fortunately, specific behavioral changes and adjustments to the sleep environment will help most children with insomnia. The recommendations outlined here are best suited for toddlers through early adolescence. Both babies and teens will have specific considerations of their own. These lists may seem long, but you don't need to implement them all at once. It's better to focus on trying a few small things at a time, giving them a chance to work, and then adjusting your approach based on how your child responds. Keep in mind that every child's sleep needs will vary based on their age, genetics, and cultural differences. Therefore, not all approaches will work equally for all children, and there may be an element of trial and error. However, your patience will be rewarded in time as you and your little ones fall asleep quickly on their own and keep sleeping soundly throughout the night. Dr. Callender goes on to say that sleep hygiene, it is a collection of habits and behaviors that promote good sleep. It is vital for children. Many sleep struggles are caused or made worse by poor sleep hygiene. When practicing sleep hygiene, remember that consistency is key. Sleep strategies take time and repetition to be effective. Now, first, create a routine. Humans are creatures of habit. A consistent bedtime routine lets your child's body and mind know that it's time to settle down and prepare for sleep. The actual routine can be specific to your child, but it should last around 20 minutes and consist of 3 to 4 quiet, soothing activities such as putting on their PJs, brushing their teeth, a warm bath, and reading. Bedtime routines provide children with a sense of familiarity and comfort, which acts in direct opposition to the uncertainty of insomnia. Next, set a bedtime. A sleep schedule works with your child's natural biological clock to promote dozing off with regularity. Bedtimes are most useful when they're consistent, so try to keep the same bedtime on weekends as well as on school nights. Altering bedtimes during the weekend will make it more difficult for kids to maintain their normal weekday schedules. Alright, the next strategy is to implement a screen curfew. The ambiguity of screens make this rule hard to implement, but it's well worth it. Mobile devices, TVs, and tablets emit a type of blue light that suppresses melatonin, a hormone that promotes sleep. Children may be particularly vulnerable to the effects of light from screens. Screen time also stimulates the brain, making it harder to fall asleep. Electronic devices should be kept out of the bedroom and ideally not be used within 1 hour of bedtime. Next is to get plenty of exercise. Physical activity is proven to help people of all ages fall asleep faster and stay asleep. Most children need at least 1 hour of exercise per day. Just make sure to avoid vigorous activity within 2 hours of bedtime. Otherwise, your child may feel wound up and find it harder to fall asleep. Next, avoid scary or violent content. Feeling scared or worried is a common reason kids can't sleep. So it's no wonder that scary or violent movies, TV, video games, or even books in the evening are linked to sleep disturbances in children. If your child likes this spooky stuff, save it for the daytime. Next, get rid of caffeine. This is a no-brainer, right? But Caffeine is a stimulant that can both make it harder to fall asleep and reduce the quality of sleep. In addition to the usual suspects like soda, coffee, and energy drinks, watch out for more discreet sources like tea, decaf coffee, which still has traces amounts of caffeine, and chocolate. Are you kidding me? Chocolate too? Yes, chocolate. Even small amounts of caffeine can have a big impact on a little body. Ooh, this is one I think that a lot of kids will have a problem with. It's don't sleep with a pet. While it's tempting for kids to snuggle up with Fido in bed, a pet's movements and noises during the night can awaken them from a peaceful slumber. Try having your furry family member sleep outside of your child's bedroom for a few nights to see if that helps. To make the transition easier, include saying good night to pets in the bedtime routine. Okay, let's move on to making a sleepy bedroom, because that seems to help with a lot of families. Optimizing your child's bedroom is an integral part of inducing quick and seamless shut-eye. People with insomnia are more likely to be distracted by an uncomfortable bedroom, which makes sleep even harder. These tips can help you create the perfect sleep setup for your little one. Okay, so first, it's the room temperature. The body and brain both cool in preparation for sleep, and this can be disrupted by a stuffy bedroom. To avoid this, try to keep the thermostat at around 65 degrees. Next, it's noise. No one likes a lot of noise, right? But research suggests that even mild sound disturbances can affect the quality of slumber, even if the sleeper never awakes. Consider noise-blocking curtains to cut down on street noise. Yeah, there's actually a thing, noise-blocking curtains. You can also use a fan or white noise machine to drown out unpredictable or distracting sounds. And next, it's the light level. Start dimming indoor lights as bedtime approaches. That's a good one. And keep your child's bedroom as dark as possible. This promotes healthy levels of and supports your child's natural biological self. If your child is afraid of the dark, a small night light is okay. And you could actually work your way from lighter levels night lights to darker level ones. And soothing smells. Oh, this is great. Soothing smells basically are common scents that can have a mild sedative effect. You might try using these essential oils or a room diffuser or dried potpourri to provide a soothing, sleep-induced smell. Don't forget, all children are different, and the quality of sleep is important, not just to children, but also to adults. Imagine having a child with a sleep disorder. If the child is awake 3-4 times a night, guess what? You are awake 3 to 4 times a night. So sleep quality is important, not just for children, but also for adults. But frequently, people don't get adequate rest. And for the parents, it can be hard to know whether your child who struggles with sleep is simply growing up or has a sleep disorder. So these are things that we have to keep in mind. And don't forget, consult with your child's pediatrician if this type of sleep disturbances continues night after night.